Hey, family, greetings, family. As you are coming in, you know what we ask you to do. We want you to hover over that like button and hit it. We want you to comment what city you are watching us from. Comment what city you're watching us from, and then hit that share button and maybe tag someone. Let them know that Dr. Samuel Abbott and Lady Hope Abbott is on with a special guest for Real Talk Tuesday on tonight. And we're talking about health, wellness, the vaccine, all of those things. So come on. I see you. I see you. Sister Zelica is already on. The East Coast is already on. I need to see who else is coming in. I'll say Columbus, South Carolina, already. Topeka, Kansas is on. Powder Springs, Georgia. All right, Retha. All right, girl. I'm sorry. Sister Cecilia. You got to say your right name, your government name. Sister Cecilia. Glad to see you on. Amen. So it's good to see you, Sister Clarissa. Hey, good to see you. Dr. Carey is on again with us on tonight from Alexandria, Virginia. She's in on tonight as well. So family, again, as you're coming in, hit that like button and comment what city you're watching us from. I see Yukon in the house. I see Oklahoma City is in the house. All right, y'all, we're getting ready. I need you to tag someone really quickly as we get ready to bring Dr. Calvin Grubbs in. So tag someone, let them know that Real Talk Tuesday is on. And if they have any questions concerning their health and different things of that nature, tonight would be the night to listen in to hear what the man of God is. I see Tulsa, Oklahoma is in the house. And I also want to take the opportunity, as you know we do, to remind you of our weekly service times. Every Sunday morning at 10 a.m. is our celebration service. You can tune in with any one of our social media outlets on YouTube or any one of our Facebook outlets or even on our webpage. And, Tuesday evenings is our Bible studies that we have deemed to be Real Talk Tuesday. But then we also come in on every Wednesday evening at 7 p.m. as well for virtual prayer and corporate prayer. Because we believe, as the old cliche says, a family that prays together stays together. But then we also believe what they also say, no prayer, no power. Little prayer, little power. Much prayer, much power. So we are excited about our guest on today, our guest on this evening. Dr. Calvin Grubbs III is a board-certified family physician who currently practices medicine in Tacoma, Washington. He obtained his bachelor's degree in chemistry from the University of North Carolina at Chapel Hill. Go Tar Heels. All right, attended.
That's Alexa.
Oh, Alexa ain't supposed to be talking right now. All right. attended medical school at the Medical University of South Carolina and completed his residency training in family medicine at Madigan Army, I hope I said that right, Medical Center. Additionally, he has earned a master's degree in academic medicine from the University of Missouri at Columbia and is a fellow of the American Academy of Family Physicians. Dr. Grubbs has practiced in a full scope of capacity in both.
Go ahead.
A capacity in both the inpatient and outpatient settings while serving as medical director for primary care practices. He has deployed overseas to Iraq and Kosovo in support of combat and humanitarian operations, and most recently served as an ICU pandemic team leader in the U.S. as part of the initial COVID-19 response. He has given multiple academic presentations at both national and international primary care conferences while having published work in peer-reviewed medical journals. His previous awards include Resident Teacher of the Year, the materials, I'm just messed that word up, Service Medical, and he can tell you what that is, the Everyday Hero Award, the Humanitarian Service Medal, and the Combat Medical Badge. He has a strong interest in medical education and helping patients. During his free time, he enjoys spending time with his family and friends, weightlifting, traveling to new places, and whale watching. V Church family, I want you all to put them hand clap emojis and make some noise for Dr. Calvin Grubbs the third. Welcome, sir.
Thanks for having me. I'm incredibly humbled to be here.
We're glad and we appreciate you accepting to come on. I'm sorry I messed up and butchered some of them words in your bio, but we know that you are a great man and a good man and a great man. And I know your mother's extremely proud of you, and Hope is talking about you a lot, and so she's extremely proud of you.
You're just messing your words up.
I am today, girl.
It's all right. I got you. I got you.
We got the doctor on. He can fix my speech today.
He's not a speech therapist.
But he's a doctor. He might be able to say something wrong with your tongue, something,
Oh, Lord.
Amen. Amen. Greet the people again.
Hello, everybody. Hi, Mom.
Hey, man, I see my mama's on. Mom, good to see you on tonight. El Paso, Texas is on here tonight as well. On there. All right, family, we're going to get it in. I know many of you have had questions. Some of you have even asked me what I think about certain things concerning the vaccine and all of this stuff. And we want to get into that on tonight. But first, tell us about I asked you on and beforehand about your day. Just tell us about your day, what you normally do, and all of that good stuff, so that people can get a little bit a better feel.
Okay.
Of what you do.
So right now, I currently work in a primary care practice, and I serve as the medical director. So my mornings are usually, seeing patients who come in for urgent care. Then I'll have scheduled appointments in the morning. And then we have planning meetings in the afternoon to kind of help shape our primary care practice to make sure that everybody stays healthy and has all the information they need in this new environment that we have.
Got you. I know there were many that was overworked when COVID-19 first came in, and people were scratching their head, pulling their hair out. How was it for you?
Well, you don't have him here.
Yeah, so the initial time period, it was pretty challenging, just given the increased hospitalizations, the increased death rate. I was actually part of one of the mobile units that set up a field hospital here in Seattle, Washington, and there were some distributed across the United States to help with the overload capacity. Luckily, over the past couple of weeks, we've been noticing a lot of decrease in the positivity rate. We've been noticing increased deaths. And I think we're just kind of starting to get to the point where we're moving towards where we need to be.
Good.
Gotcha. So you said we're getting to the point where we need to be. What is that?
So just kind of some level of normalcy. You might notice in just kind of different places around the country, we're starting to slowly open back up. People are on board with wearing their masks, social distancing, and just doing all the right things to kind of get us better and healthy.
Got you. I briefly asked you about some things we can do. So what are some things we can do now to be getting healthy and all of that stuff?
Yeah, so in addition to mask wearing, social distancing, and we'll probably talk some about this later, and getting vaccinated, I think just doing a lot of things to help maintain your mental health and doing things to maintain your physical health, such as exercising, eating healthy, and then just doing things to stimulate your mind so that you stay resilient as a person.
That was something Dr. Carey said about having a personal care program, and she had listed some things in a personal care program, and some of it was about exercise, eating healthy, and some other things about your mind as well. So I can see in the psychological world and also in the physical world as well, physical medical world as well, there's some similarities with that piece as far as being healthy. Comment on that, if you will, some more.
Yeah, I think it's pretty well established that there is a significant mind, body, soul connection. And whenever you have imbalance of one of them, it tends to make you less resilient. So I absolutely agree that, you have to have all three in balance for you to stay healthy. Because if you're missing one, then, just things start to go awry from there.
Got you. So I read a lot of stuff. I've gotten some stuff off from Dr. Jill Wagner concerning what we could be doing as far as vitamins and all of that stuff. What is your take on doing those things now pre-COVID?
So I think pre-COVID, even in the COVID environment, a lot of the things you can do is just maintain and eat a healthy, well-balanced diet, making sure that you're getting all the big food groups. And a lot of the times, as far as like the vitamins are concerned, they could be effective adjuncts to your healthy diet. And it helps to improve the overall efficiency of your health.
What about the disparity rate that they're saying between African Americans or brown people versus our Caucasian brothers with like vitamin D and our African Americans vitamin D deficiency? What are some things we can do about that? And does that play a role in our immune system and building it?
Yeah, so it's really well known that vitamin D plays an important immunologic function, and you're absolutely right. In the African American community, vitamin D levels tend to be lower than our Caucasian counterparts, mostly because sunlight is one of the things that are important in interacting with the skin to make vitamin D. So one of the things that you can do is supplement with vitamin D. If your vitamin D levels are low and you're having symptoms, getting adequate amount of sunlight. Those are the biggest things that you can do to help with that.
Do you recommend when we go to our doctors, when they do blood work and all this stuff, that we get our vitamin D levels?
So in general, I don't recommend just getting vitamin D levels unless you're having some kind of symptoms. They've done a lot of studies that have shown that vitamin D levels don't necessarily correlate with some of the things that traditionally we thought they did, such as fatigue, decreased bone density, etc. So if you're having a lot of mood-related symptoms, you're having a lot of fatigue, that is not responding to just kind of like your normal therapies, I think it is worth asking your doctor at that time to check a vitamin D level, and if it's low, in the context of having symptoms, at that time supplementing with vitamin D.
There's a question someone asked, how much sunlight a day is recommended?
So in general, just being outside, just kind of depending, between 20 and 30 minutes usually is adequate to kind of help with your vitamin D stores. But just as mentioned beforehand, just because in African Americans, we have an increased amount of melanin in our skin, the penetration from the UV radiation tends to be lower than our Caucasian or light skin counterparts. So just kind of doing those sorts of things.
What are some things that we can do if we get COVID-19?
Right. So if you get COVID-19, the biggest thing you could do is isolate yourself to prevent the spread of COVID, making sure that you're taking care of yourself and monitoring your symptoms, and then being in line with your healthcare provider to make sure that, we're tending to all of these needs. Most people who get COVID usually don't have any symptoms, but they are spreaders of COVID. But just kind of maintaining a healthy diet, maintaining your sanity while you're in quarantine or self-isolation, and you just making sure that you're taking care of yourself. Okay.
You said maintain your sanity. I heard there's something what they call the COVID brain. What is that, or is there a such thing?
Yeah, I absolutely think it's such a thing. I mean, over the past year, we've all been, separating ourselves from people, staying at home, like all of our favorite places like restaurants, stores, and jobs. Everybody's been teleworking, and people need that social connection. So I think it is pretty easy to get worn down when you're in these sorts of environments. So I it's really important to just help rejuvenate the soul, maintain, healthy relationships, etc.
Got you. You have any questions?
Well, I was just okay. I was just going to ask one or two questions, like being a physician, do you recommend that people take the shot? And I do believe you have taken it, correct?
I have.
Okay, and what shot did you take and why?
So first off, I want to say I absolutely recommend that everybody take the vaccine if you have the opportunity to do it. In order for us to reach our desired end state of returning back to normalcy, it's super important for us to maintain something called herd immunity, where most of the community, usually about 80 to 85%, are protected against COVID-19 with just your natural antibodies. The vaccine that I had was the Pfizer vaccine. So that's a 2-shot vaccine where you get one on day 1, and then the other one is separated by 21 days. And the reason I got that vaccine was essentially because that's what my facility had. You're probably aware that there's another vaccine. It's called the Rna Vaccine. That one is also a 2-shot series where you get one at day 1 and then one at day 28. And it's been shown just through numerous studies that they're approaching like 94 to 95% effectiveness. So the vaccines are pretty effective.
So have you had any side effects from the shot? And when did you get the shot?
So I got the shot when it first, the first week that it came out, that it was in distribution. And then I got the second one just shortly after the new year. So after the first shot, I did experience some symptoms. And that's not necessarily a bad thing, because that tells us that our immune system is doing what it's supposed to do to form the appropriate antibody response to help make sure that we're getting protected against, foreign substances that are entered in our body. After the second shot, I had absolutely nothing. It was completely perfect.
Okay.
What do you know about the Johnson & Johnson shot that's coming out?
Well, that's a great question. So that one is one of the ones that's in production where it actually, on March 1st, it's going through to the FDA for its emergency use authorization to start being distributed in the United States. That one's a little bit different from the other 2 vaccines in that this one has been shown to be about like 93 to 95% effective. And it is a 1-shot vaccine compared to the other 2.
Okay.
Now, with the prediction of new strands coming out being more potent or more contagious than the other, will these vaccines work on the new strands? Question A. Part B is, how long does the vaccine work, and if and when do we need to take it again?
Great questions. So as far as like the new strains of the vaccine, so far, studies have been showing that it is effective against it. I think the way that the vaccine works, it's actually an incredible feat of science, where it's a different kind of vaccine compared to some of the other ones. We call it like a messenger RNA vaccine, and it's coated in just kind of like a capsule that when it gets injected, it goes into your cellular network, and it essentially makes proteins that make some of your cells look like it had, some of the proteins from COVID. Your body builds an antibody or an immune response to that, so that whenever you get it, both, the old strains and new strains, you're protected against them.
Gotcha. We got a lot of questions popping in right now. Okay. One is, can you talk about how important it is for people with pre-existing conditions to get the shot, to get the vaccine?
Absolutely. So if you have pre-existing conditions, you are actually in general on one of the higher tiers to get the vaccine. So you're prioritized against or before the healthy population. And whenever you have a lot of medical comorbidities, especially things like, respiratory problems, heart-related problems, things like diabetes, those all have negative impacts on the immune system. So it makes you more susceptible to having problems if you were to contract the COVID-19 virus. So I think it is critically important for those groups to ensure they get the vaccine in order to stay protected. Things that you've seen earlier on in the pandemic is there were tons and tons of people who were in the ICU, tons and tons of people who were getting intubated, to the point where we were running out of ventilators to put people in. And a lot of those people who have symptoms usually have a lot of medical conditions that are associated with it. I forgot what the second question you had on there.
There's another question that says, is it true people with O positive blood are less likely to contract COVID-19?
Also a great question, especially because I have O positive blood as well. So it is the increasing experience that if you have O positive blood, it is less likely, just because of some of the antigens that are present on the cell surfaces of the O blood type. However, that does not necessarily mean that you are like that's 100% foolproof and that you are immune to it. But a lot of studies have shown that that has been the case, that there have been decreased rates of COVID infectivity if you have O blood in general, O negative more than O positive.
Gotcha. Here's another question. What are some of the side effects that you've heard of from the vaccine?
So the most common side effect from the vaccine is actually pain at the injection site. Other things that people experience are things like fatigue. Sometimes people get like these low-grade temperatures where they feel chills. But the good thing about that is within 24 hours, usually those symptoms go away. But the highest rate of side effects is usually pain at the injection site.
Yeah, I know someone. Go ahead. I'm sorry. Go ahead.
And I just want to point out that a lot of those side effects are the same side effects that you get with any routine vaccine that you get.
Yeah, I know someone who was getting the vaccine, and it was told to her to possibly take some Tylenol like an hour or so prior to her getting the vaccine, the first shot. Kind of like when you do, when a child goes and gets their vaccinations, they generally tell you give them Tylenol.
Absolutely. And that's actually what I told my dad to do when I strongly encouraged him to get the vaccine.
Did that work?
He did. So he actually didn't have the symptoms to the same extent that I did. And I unfortunately didn't take any Tylenol before I had the first vaccine.
Here's another one. Should you get vaccinated if you have antibodies?
Yeah, that's a great question. So you absolutely should still get vaccinated if you have had COVID and already have antibodies. What the experience is so far is that people who contract COVID and they actually get antibodies from it, the natural immunity has been lasting between like 4 and 6 months. And then just kind of waning from there. And a lot of the antibody response that you get from taking the vaccine, again, it's pretty new, so we don't have a lot of the experience or data with that, but it's projected that, for a year, even year plus.
Here's a really good question from Dr. Carey. What happens if you don't get the second shot within the 28 to 30 days?
So that is a great question. So if you don't get the second shot within that time period, you should still get the vaccine anyway. I don't necessarily think that it's going to have any significant decrease in the overall effectiveness. The reason that we're pretty tied to those specific time periods is mostly because things are so new. And in order for us to not have any bad side effects or not have, anything go awry, we want to try to maintain the narrow parameters that were set by the studies that were done. But I think as we start to see, have more experience with the vaccine, that condition will probably start to be more relaxed.
Wow. Well, I told you, everybody, those of y'all that are on V Church, we need you as Dr. Grubbs is on answering these questions. Tag people, share this now so they can get on and get this information. This information that is going forth tonight will save your life. Here is another question. Someone is saying, I have diabetes, diet controlled in 3 days after the first injection of Moderna. I had high blood pressure readings, severe headaches, and vertigo. Could that have been related to the injection?
So I do think that those things could have been related to the injection. So the injection, when you get it, it mounts a huge immune response where it's looking at what's inserted into your body as foreign. And what that does is that causes some of the other systems, most specifically your cortisol levels, because your body is stressed, to increase. And cortisol is correlated to, some of these increased symptoms. So especially in diabetes, where you typically have issues with glucose control, that is something that you could anticipate from that. But hopefully the experience after getting it was that after the first 24 to 48 hours, that symptom essentially went away.
Here's one. Once you've taken the vaccine, will you still need to wear a mask all the time?
So great question. So right now, the CDC recommends that is something that we need to do. And the reason that that's still the recommendation, because I think it's too early for us to tell whether or not getting the vaccine prevents spread of the vaccine. So right now, our experience based on the short duration that that's been in implementation is that it either A, prevents you from getting COVID-19, or if you actually get COVID-19, the antibody response makes the disease less severe, but we don't yet know if it prevents the spread of it. So it's still important to continue wearing your mask until we have more experience with the vaccine. It's still important to socially distance whenever you are able to.
Hey, we just gonna go down the line. Do you think the COVID-19 vaccine will be a yearly shot like the flu?
So this is also, there's lots of great questions that are coming out here. So right now, I think it's too early to tell, but just kind of looking at the pattern. So the reason that we have to get a yearly flu shot is because the influenza virus goes through these two processes called genetic drift and genetic shift. So essentially what that means is that every year that virus is constantly mutating as it migrates from the northern hemisphere to the southern hemisphere. So it's constantly evolving to the things that we're doing for the vaccine, which is why that vaccine is a yearly shot. Right now, that's not been a lot of the experience with the COVID-19 vaccine, although we have seen some mutations just kind of overseas, and some of it started to come into the United States, but it's not as rampant as we initially predicted there. So I think right now it's too early to tell, but if I were a betting person, just based on how the microbiology of that particular virus works, is I think we'll probably have a little bit longer lasting immunity compared to the flu vaccine. But again, don't quote me on that.
Cool. Here's another question for you. Why is the vaccine given in 2 injections?
Oh, so that is another great question. So the vaccine is given in 2 injections because the initial studies based on the dose that was used showed that after the first vaccine, especially like with the Pfizer, it was only 54% effective at preventing, contracting the COVID-19 virus. And then after the second vaccine, you build up more of an immune response so that it's now 95% effective. Same thing was the experience with the Moderna vaccine, where the initial effectiveness was about 34% after the first vaccine, and then it approached 94% after getting the second vaccine. One of the things that I think is interesting, just kind of based on dosing things with the Johnson & Johnson, they're having great dosage responses with their one-shot regimen. But I think just kind of as time goes on, and you probably heard in the news or seen with some of the Israeli studies that were just released, that, we might be, as we're getting better with this, that might be evolving.
Wow. Here's one. Should you take the vaccine if your diabetes and blood pressure are not totally controlled?
Yeah, so I absolutely think you should take the vaccine in both of those scenarios, in addition to getting diabetes and blood pressure under good control. The thing about it is, if your diabetes is not under control and your blood pressure is not under control, and you happen to catch COVID-19, that significantly increases your risk of having complications with the virus, as your immune system is stunted and is less capable of handling, that invader to the body.
Here's one. Do you know how many strands of the COVID-19 virus that have reached the United States?
So that question, I don't necessarily know, how many strands, because whenever we are conducting our testing, we don't necessarily do specific strand typing. So I do not know the answer to that question.
And will it be necessary for our children to take this vaccine as well?
So that's an interesting question, because that's something that has been debated since the initial parts of COVID-19 as it started to spread throughout, the world. Initially, the experience was that children were the least susceptible to getting COVID-19, which is what basically gave birth to that idea that, hey, maybe we don't need to vaccinate our children. But we're starting to see this shift where children are starting to get COVID-19. And you might have seen of the case, in Missouri, where there was a 13-year-old who unfortunately died after contracting COVID-19. And that's starting to become some of the experience. Luckily, it's not one of the ones that's a widespread experience. So again, we closed down schools. all of these things just to kind of help protect people. So we've been seeing more and more that, kids are like, even though they might not have symptoms, just like some of the healthy adults, it is still possible for them to get it and spread. So I think that will absolutely be something that's coming down the pipeline.
I think this is a good question right here.
Are there any major differences between Pfizer and Moderna? And part B, would you endorse one over the other?
So between the Pfizer and Moderna vaccine, there's no difference between the two of them. The only difference is the manufacturer that made it. So I don't endorse one over the other. They are both in the 94 to 95% effectiveness.
Got you. What about cleaning purposes? Because I know they say you have to clean hard surfaces different than you would soft surfaces. What are some things that we can do about that?
Good question. So a lot of the things that, like us in the healthcare community do is when we're at work and we're exposed to patients with COVID-19, before we come into our houses, we completely, change our clothes and then just kind of immediately wash them in hot water. I think just kind of like doing your normal precautions, where you're using like sanitation wipes to clean off all of the important surfaces, and then, doing similar things for your soft surfaces, because it's been shown that the virus, can live on surfaces for longer periods than you think, approaching like 7 to 10 days.
Wow. Here's another good question. What is the youngest age that a person should get the vaccine?
So right now, with the emergency use authorization from the FDA, the youngest age that you can get the vaccine is 18. As more and more things are getting done and it gets full approval, then the age changes will probably happen. And then one thing I wanted to point out as far as like the emergency use authorization is that is a thing where you can get products that are produced into circulation faster in emergency or pandemic situations after adequate studies are done to show that they have been proven to be effective or safe in general.
Gotcha. Good. So you said age 18. They were going back and forth on mandatory shutdowns and or leaving things open. And I know in the other administration, they left it basically to the local government. I don't make it political, but what's your take? Should we have a mandatory shutdown so that we can get it under control? Or do you think we can get it under control being open the way we are now?
I actually thought this question would come up, and I think it just kind of has to do with what public health strategy, because they both can be like equally effective. So you have to consider what you want your overall end state to be, right? So if you want to be like, hey, I want to capture like more towards the 100% of the people, then great, you can kind of do some of these shutdown things, and then a lot of people are not exposed. If you're doing that to the strictest level. I think earlier on in the pandemic, those are things that probably were necessary, given the increased hospitalizations, the rate of spread, not knowing things about the virus in general. And as we kind of learned more and more people started to get it, we started to notice that people are having kind of like these natural like antibodies. And again, some of the decreasing rates that we're seeing now, likely due to certain level of herd immunity. And that's included, just kind of getting COVID-19. And then just kind of the increased vaccination rates that are starting to happen across the United States and across the world.
That herd immunity is a buzzword that's been used a lot here lately. Explain that some more for our viewers.
Okay, so herd immunity is a concept in immunology, which is essentially the study of your immune system that shows that once a certain percentage of your population has been infected or vaccinated against a disease or illness, it effectively excludes it, from the population. So, back like in the 1970s, I know I was not born in the 1970s, like there were things like polio and all of that other stuff. And again, it reached a level of herd immunity where, again, that disease process was effectively like eliminated from the United States. So that's essentially how herd immunity works. The target or the goal is to try to approach that 80 to 85% range because that's what's thought to be the most effective in protecting the entire population.
Gotcha. Here's another question from Ms. Grant. If fully immunized and you come into contact with someone who tests positive, you don't have to self quarantine. Is that correct? And how long? And I thought if it's less than 3 months. So I guess they think it was less than 3 months of self quarantine. But you see the question answered.
Okay, cool. So one of the things that we're starting to see right now is that if you're fully immunized and you do come in contact with somebody who tests positive, like right now, because again, everything is just kind of like in the initial phases, the recommendation is to still self-quarantine because we don't necessarily know if it 100% prevents the spread of COVID-19. So that's more of a factor to protect other people like in the population, especially like the vulnerable people. So those things might be changing. The CDC is constantly publishing, guidance about, hey, if you're fully vaccinated, again, you probably noticed that it went from, hey, you got to be quarantined for 14 days, now down to days. And then in some places, they're even authorizing 7 days. So I think as we know more and we get more experience with this, we'll start to see some of those things go down because it's looking like it potentially does prevent spread. But again, don't necessarily know.
What of our counterparts from other countries, what are they doing that is effective that we are not doing?
So that's a complicated question because I think our populations are pretty different. There are, certain concepts like population densities. They're just kind of like certain things where, you might have seen, hey, some countries didn't lock down and they have like decreased rates, but those populations tend to be smaller than ours. And then just kind of like the different factors or determinants of health are overall different. So I think it's more important to just kind of consider, the factors that are impacting, the individual country that you're in. And, sometimes you comparing to the other ones are not necessarily like beneficial, mostly because, the ways that people live are different. And then the health levels are different, the population numbers and population densities are different, et cetera.
Here's one. I've heard that some people that tested positive for COVID-19 and they were retested after a month and tested positive again. Why is that?
So that's a phenomenal question. So once you can track COVID-19, the infectivity period is usually about 10 days. Sometimes it could be up to 14 days, but if you're not having any symptoms, the 10-day is the mark. The genetic material that basically, or the genetic protein that is in COVID typically can linger in the system for 90 days or so. Even if you have already, feel better and you're not having any symptoms. So that's actually why among the newest recommendations is that after you have COVID-19, it's not actually recommended to get another COVID test again, because it is likely that you're going to test positive anyway, whether you're having symptoms or not. And that's not necessarily reflective that you have a new infection of COVID-19.
I had read that that depended on the test as well. Some tests show that if you're infectious, and some show that if it's just in your system. Is that true?
So that is true. So right now, there are two predominating tests to test for COVID-19. The best one is being like the PCR test, which basically, it gives you the most accurate results. And it actually is one of the fastest ones that you can get back. And it uses like the highest level, of molecular detection compared to some of the other tests. The other one that you're referencing is actually the antibody test, which again, the effectiveness is whether or not it tells you that, hey, if you actually have COVID, it's a lot lower than the PCR test because the PCR test accuracy approaches 98 to 99%. Obviously, for anything, you could have false positive results, but for all intents and purposes, the PCR test is the gold standard for determining whether or not you have COVID-19. With the antibody tests, you're absolutely right. There are two types of antibodies that your body makes. Well, actually, there are five, but the ones that are most important to, the testing process is something called IgM and IgG. And those are two of the proteins or the immunologic proteins that are tested by the antibodies. And the IgM is basically what tells you if you or it suggests you had a recent infection. And then your IgG is what tells you, hey, you don't have a recent infection, but you have longer lasting antibodies for it. But the antibody tests that are currently in production in the United States are extremely variable. And, whenever you get a positive antibody test, the thing you have to do is get a PCR test anyway.
Got you. Any questions,
No. He's doing an excellent job. He's answering all the questions. I'm proud.
I know you would be. There. Now, with these tests, are there any other tests that we can take that will let us know besides the saliva and or them sticking that thing up and
your brain
and hitting your brain and pulling it out?
Yeah, so those are the biggest ones that happen. So the saliva tests tend to be less effective. You probably saw in the news where, China is kind of doing like a fecal test where they're kind of having that kind of in production right now, but that is not something that is widespread in the United States. And then the saliva tests, you probably started to notice that, there's some home COVID tests that you can get. And it does take the saliva. You can just kind of send it to the lab and then it can test from there. But the saliva test tends to be less effective. So unfortunately, the tests where you go into the nose called the nasopharyngeal test is the most accurate one because you can get what you need in order to run an effective PCR test to definitively tell you whether or not you have COVID-19.
Now, I also heard people say that once you've had COVID, it needs to be a certain time period before you can get the vaccine. Is that true? And if so, what's the time period before you take the vaccine?
So that's actually a myth. So after you get COVID-19, as long as you're not having any symptoms, you can get the vaccine afterward. And like what it would do is it actually helps to stimulate your immune response even further.
Look, your mom is so happy. Look, your mom is so happy. I'm just putting her on blast. Your mom is so happy. Her baby up here answering these questions. Here's one. Do you believe we are now prepared for the next virus that may pop up?
Well, that is an incredible question because the COVID-19 virus basically rocked, our, ability of how we did things in general. So you notice that, hey, maybe we're not as prepared as we needed to be because the last time this happened was, with the Spanish flu back, between 1918 and in 1920. So I think we're learning a lot of great things about, how we operate. We've re-emphasized the focus on pandemic planning and pandemic response. So I think as time goes on, we understand the importance of it and we will continue to make forward strides. I think the thing that we have to be cognizant of is that, as we become further and further away, from this particular pandemic, likely similar things that happen, with the Spanish flu, like there'll be less and less emphasis on it because a lot of the biggest pandemics that's happened, since time happen in 100-year intervals. So as you move further and further away from it, we tend to forget, what things were like, and then we become complacent. So I think as long as we maintain, our tenacity of efforts and ensure that we are continuing to, move forward and, do a lot of these good research interventions, appropriate planning, I think we would be ready for the next virus.
Hey, your auntie Monica from Los Angeles says she's proud of you too, and she's smiling from ear to ear. So we're gonna put that out there too, Auntie Monica. look.
You are well loved, okay? There was a question.
Do you think we will ever go back to what we knew as the norm? And if not, why?
So I do think as things start to improve and we start to notice improvements in the overall pandemic, we have less people dying, less people contracting COVID, less response for the overall need for hospitalization. I think we'll start to see, that things will start to get better and we'll have a new sense of normalcy. The biggest thing that, Dr. Fauci's predicting right now is like that might even be something as close as to, closer to the end of this year, as long as we do the things that we're supposed to do, continue doing that, continue our vaccination efforts, and then continue to encouraging people to just kind of like be safe and staying healthy.
Here's one. Should a 93 years young person or older that have a health problem, should they take the vaccine?
So they should absolutely take the vaccine. And that's actually one of the targeted populations right now, as far as like the prioritization group is concerned, because the over 65 to 70 group is amongst the most vulnerable. So it is highly recommended that, they get vaccinated as well.
That's a good one.
What is your advice in wearing a homemade mask versus an N95 mask, part A? Part B, how much does our chances of contracting the virus decrease if we wear an N95 mask versus a homemade mask?
So that is a fantastic question. So the N95 mask is probably like the gold standard in medical environments for preventing the contraction of the virus. The thing in the healthcare population is you're the most likely to be in contact with the most severe forms of it. You probably remember in the initial part of the pandemic, they're like, oh, masks are necessary, masks are not necessary. And then we just kind of shifted towards wearing some of our homemade mask. And you're also seeing some of the things right now where we're starting to pitch using double mask and having specific materials. So I think ultimately the N95 mask, again, stands for preventing 95% of things coming into you, is probably the most effective. But just given the limited resources that we have in the United States and the need to kind of shift some of those resources to people who are taking care of the high risk and high vulnerable people, we should preserve those particular masks for those working in that population, such as COVID ICUs, working on the COVID wards, and then just kind of out in the population using face coverings to minimize that spread from there.
Good. That's good. After my second dose of the Moderna vaccine, I had nosebleeds where I ended up in the ER. Have you heard of any nosebleeds from vaccinations? Also, several other coworkers had nosebleeds as well.
So that's interesting. So that is not one that I have heard of from taking the vaccine, but that's not outside the realm of possibilities for that. So I would have to look more into that because that's not one of the common things that I see in our vaccinated population.
Wow. Wait a minute. Here's another one. Your friend, Lawyer Bill, is also proud of you too. All right. Here's one. So since I had COVID, if I decide to take the shot, will I get sick from taking the shot?
So that's a great question. So I think because you already have somewhat of an antibody response, it makes you less likely to just kind of feel some of the effects that somebody who has none of the antibodies from it. Because the reason that people feel sick after either catching an infection or getting a vaccination is because the body's immune system views that as foreign, and then it starts to cause an inflammatory response where everything in the body goes awry, and then you just kind of feel crummy overall. So if you already have some of the antibodies after contracting COVID, it is less likely that you will have symptoms. Not that it's outside the realm of possibilities, but it significantly decreases the likelihood of that happening.
Here's a question someone asked from your aunt: will we be wearing masks into 2022?
So that's a good question. I think it's too soon to tell. I think just kind of how things are going, probably in the initial phases of 2022 or the initial months, we'll still be doing that. But I think as we start to approach herd immunity and COVID levels start to decrease, I think unknown, but I think probably into mid-year, should we continue on the trajectory that we're on right now, that is a very real possibility.
Your daddy on here, he said he proud of you too. Look, Dad said, hey, all these people talking about they proud of my son. I'm not too.
Let it be known who the daddy is.
Look, here's one. Are there any long-term effects that could derive from the current vaccines provided?
So I think that is a possibility, but that has not been the experience that we've seen so far. I think the thing that a lot of patients especially ask me when they're, considering whether or not they need to get the vaccine or they want to get the vaccine is that we only kind of have experience of it over the last 6 months or so. And then I think it takes time to continue study. This is actually like a plug for the V-Safe app after you get the vaccine. It basically helps track your symptoms, and that's giving us a lot of data to determine whether or not there are going to be the potential for long-term complications of it. So that being said, it hasn't been the experience so far, so I still recommend that you get the vaccine.
Wow. Do you recommend shielding face shields or safety glasses along with wearing the mask?
So that's a good question. So, if you're going to wear it along with the mask, I do think it adds a different barrier. So you have another level of protection. However, if you're not going to wear a mask and you're just going to wear the face shields or the safety glasses, that has been shown to be less effective than using appropriately cloth mask.
Okay.
Now, I also read about COVID causing blindness in Africans. Have you heard anything about that? And if so, why is that?
So I haven't heard about COVID specifically, causing blindness. However, in populations that are vulnerable, such as diabetes, like those patients who contract COVID, tend to have more issues like with sugar control, which actually is one of the leading causes of blindness, in diabetic patients. So I don't think that there is knowledge that there's any causation for that. I think that's more correlation from that at this point.
Gotcha. Here's one. Is it true that the shots also allow the government to implant other entities in your body, chips and things?
Thank you for that question. So that is absolutely not true. So like I mentioned beforehand, this vaccine, it's absolutely incredible. Essentially how it works is like you have a specific protein that is, in like a biologic capsule that when you inject it into the arm, it goes into the bloodstream, goes to your cells, and then it makes proteins that kind of mimic what the COVID-19 virus looks like. It is impossible to inject, microchips, different plants to control you. So that absolutely a myth.
What about the thing that was out about the vaccines shifting your DNA?
Ooh, that is a great question. So, not to get too technical, your DNA is housed inside the nucleus inside your cell, and your nucleus has something called, a selectively permeable membrane. That messenger RNA from the COVID-19 vaccine cannot get through that vaccine, so it is impossible for your DNA to be altered after getting the COVID-19 vaccine. So I actually appreciate that question because that's one of the most common ones that I get as far as, hey, does this change my DNA?
Here's one. Does the vaccine interact with any other medications that someone may be on?
So the vaccines have not been shown to interact with any medications whatsoever right now. There are specific targets for most medications, and those tend to be, receptors on cells. And the vaccine doesn't have a vehicle to be able to do that.
What about someone said they've talked to people that are afraid to take the vaccine? What would you tell a person that's afraid?
So I think it's really important to understand that there is a lot of uncertainty that is related to something that's new, just kind of like given things that, are historical. A lot of people don't understand all of the factors that go into production. And I think it's pretty legitimate for people to have concerns about, hey, whether this is safe, whether it's effective, and, has there been enough time? So my approach to this when patients are having some angst about it is just to acknowledge that, hey, this is scary stuff. I was initially, concerned about, hey, should I get this vaccine? And I had a lot of discussions with my other physician colleagues about whether we should do it. And I can tell you, as far as when it first started to get pitched out, we both made the collective decision to say, yeah, we're not getting this. But as we started to read the studies, critically appraise them, look at the data, look at the methodology for how everything is done, we were pretty confident that the vaccine is safe and effective. It's continuing to prove to be the case. So I think just with education, I think that just understanding where that patient is coming from or where that person is coming from, acknowledging that, hey, this is something that's scary, and then just work together to come to shared decision making as far as getting the vaccines concerned.
I like this question here. As a white privileged male, how can I help my Black and POC brothers and sisters understand how important it is to get the vaccine?
So that is a phenomenal question. And I think just continuing to provide education, directing them to resources, trying to dispel, just kind of certain things that happened in the past. Because I think a lot of the hesitance with the vaccine, especially with African Americans and people of color, tend to be due to just kind of the things that happen with the Tuskegee experiments. And, I think that's something that continues to linger, in our community as far as that's concerned. I think just kind of reassuring that, hey, the processes are changing, we're, getting better. Again, the ways that we do research methodology is pretty strict now compared to what it was beforehand, and just continuing to provide encouragement, continuing to provide support, and then just be non-judgmental if they're not wanting to get the vaccine immediately, and continue to work in their life space to, try to convince them or encourage them to do otherwise.
Here's another good one. Does it matter if you take Tylenol or Ibuprofen before taking the vaccine? A, and B is, will taking one of these meds beforehand cause the vaccine to be less effective?
So that's a good question. So both Tylenol and ibuprofen, which is also known as Motrin, they work differently. So Tylenol is something called an antipyretic. So it both reduces fever and it helps with a pain response. Ibuprofen is something called a non-steroidal anti-inflammatory drug, and it's a medication that kind of targets the inflammatory response. So they tend to do two different things, but pain can be caused by inflammation in general. So again, what you take beforehand doesn't decrease the effectiveness of the vaccine once you get it, but it does target different symptoms. So for example, if you're more likely to, or if you're having fever related symptoms, your NSAIDs typically don't help with that, but Tylenol does. So, taking one or the other just kind of depends on, what your previous experience with vaccines are.
Also, read about having your wellness, what I used earlier, but they was on a walking regimen, wellness regimen. They was on a walking regimen. They tried to get their 10,000 steps a day. They did breathing exercises and things of that nature to help in the lungs. Do those things help your immune system? Does that help if you get COVID-19?
Yeah, so those things absolutely help because they make your body more resilient. Doing breathing exercises, it improves the efficiency of oxygen flow in the lungs. Walking keeps you strong and keeps you healthy. Because again, everybody thinks when you're exercising, it has to be something intense where you're running miles and miles or you're lifting tons of weights. But you got to find things that you like to do to make it more enjoyable for you, whether it's gardening, whether it's swimming, going on the elliptical. And the recommendation is just as long as you do 30 minutes of cumulative exercise, whether it's you do it all together or do it in 10-minute spurts, and trying to achieve that 10,000 steps, all of those things have been shown to be beneficial in all health conditions in general. Makes your immune system stronger, makes you more resilient, so overall effective.
What about the particular meats? Because I also understand about red meats causing inflammation and things. Do we stay off red meat right now during this season, or is it something we can continue on eating? And if so, what do you say about that?
So I think that's absolutely something that you can continue doing. I think just kind of like in the medical like research, like we've kind of like flip-flopped back and forth, which I do think causes some confusions with, patients, especially like in the nutrition realm. Just the kind of caveat, like with cholesterol, first they're like, hey, cholesterol is really bad. Oh, cholesterol is really good. Oh, it's bad again. Now it's good again. So I think as time goes on, I think we're starting to learn more and more about like, what's actually causing, some of the symptoms that we have. So red meat inherently is not necessarily bad, and it's not necessarily required to remove from your diet, but I would encourage, just like everything, doing things in moderation is something that's important.
I also heard this one too about this question. So is it true that COVID-19 virus thrives on ibuprofen, causing a person to become worse?
So that's a good question. So that is a myth. Like the thing with the COVID-19 virus, like it doesn't stimulate like any inflammation. It stimulates an immune response. So I think that's one of the things that gets a lot of people confused, because they think your immune response and inflammation are one of the same thing, and they're not necessarily, like they're nested with each other, but they're not necessarily the same thing. So it is completely okay, if you take the vaccine and you're having symptoms, to just take an NSAID if that's something that you're comfortable with. But I do, just kind of caution against just kind of using NSAIDs, pretty routinely, because out of all of them, it tends to affect the liver, especially like, if you have a history of kidney problems or anything like that.
So is it safe to say that one of the best things we can do is build our immune system? And if so, what are some things we can do to actually build our immune system?
Yeah, so the cornerstones of building a healthy immune system is actually just kind of taking care of that trifecta of mind, body, soul, and your physical nature. Every time that you're exercising, you're making your body, strong. If your mind is not just at where it is at its peak performance, like you get stressed out. Stress increases cortisol levels from the adrenal glands, and that also causes some systemic effects within the body, which again, cortisol is something that it's a stress hormone, and that actually decreases the effectiveness of the immune system, because whenever we have patients or people with autoimmune disease, we tend to use steroids to help calm that down. So I think decreasing stress levels is critically important to help maintaining a healthy immune system, eating an appropriate diet, because that's going to provide the necessary cofactors to help, drive the processes that are responsible in the inflammation response, and then just making sure that you're physically healthy so you maintain your resilience.
Wow. I have one other question, because I told you I want to keep you, because I know you're a busy man in a certain time frame. As schools are going back and forth on reopening or staying shut, churches are going back and forth whether on reopening or staying shut. I know here at Kingdom Life, what we're doing is we've allowed only a certain few, like our core leaders, our musicians and core leaders in, and everything else is virtual. What is your recommendation as far as opening, not opening? If you do open, what should we be doing?
Right. So I think that question is more stemmed towards just kind of like how rampant COVID-19 is in a particular community, right? So like, if you have low rates of COVID, and this is why I think things shouldn't just be massively applied to everything, is because like the experience, just like we had talked about, like in different countries, like it's different in different community levels. So I think if you have a low rate of viral transmission in the community, I think those are markers to start moving into just returning to normalcy. But if you're gonna do it, like I think you still need to continue to do the things that you need to do, like mask wearing, social distancing, and making sure that, if you're sick or having symptoms, staying at home, washing your hands, all of those things that we normally do to prevent viral spread.
Good. So here's a couple of other questions that a couple of people just chimed in on. One is, what is the most effective regimen of vitamins to take?
So that's an interesting question, because this is something that I talk to my patients about a lot, because you're like the nutrition and the supplement community is just kind of like taking this and kind of like running rampant with it. So the first thing I want to point out as far as like the vitamins are concerned is all of those fall into a class of, quote unquote medications that are not, they're not FDA approved or evaluated by the FDA. So in general, I actually tell my patients not to necessarily take vitamins if they're maintaining like a healthy balanced diet. So for example, like, if, you eat a lot of fish, again, you're going to get your things like your omega-3s. So it's not critically important to supplement it additionally, because if you have a lot of these vitamins, you can actually create pathologic conditions where it does harm to you. Wow. So for example, if you're taking vitamin B6, and then you continue to take that, and you get higher levels of it, it can actually cause damage to your neurologic symptoms. And then you can get symptoms like, vertigo, where you're having the room spinning sensation. You can get kind of weakness, numbness, and tingling in the extremities. If you have too much vitamin A, you can cause visual problems. So the vitamins are not a benign process, because when you take them in excess, they tend to create problems for you.
Wow, that's good.
Yeah, so the approach that I generally take with my patients is, hey, if you're if you're eating and maintaining a healthy diet, getting equal balance, then there's generally no need to take extra vitamins. And this is especially true with the vitamin D thing, because that's like the biggest thing that I see people, do. Like in the winter months, when it tends to be more gloomy and less sunlight. Well, especially like here in the Tacoma, Seattle area. But if you're doing all the things that you need to do, you generally don't need to take vitamins in general. So that's actually one of the things that I recommend against, unless you have a thing where you're like, hey, I don't eat this particular food group, or I don't like this, and then supplementing is helpful in those situations.
Wow. Someone asked this question, if you can see it, is if that medicine a good choice of medication for COVID-19?
So that medicine, it's called ivermectin. So ivermectin is interesting because that's actually an anti-parasite medication, and COVID-19 is a virus. And I think there have been some variable studies on whether or not that is something that is effective. So right now, I think, hey, I can't necessarily say, hey, that's one of like the first choice or first line medications for COVID-19. Just kind of like your antiviral medications, if you're in kind of like this severe setting, are the best ones for that.
Wow. And we just want to say thank you.
Yes.
Again, for taking out of your busy day and getting on to help save lives.
Yes.
I want to challenge you, V Church, to share this, and maybe somebody can come and watch it later on.
Right.
And just like we were replaying with Dr. Carrie Register Haley and about our health, our mental health and mental wellness, we'll be replaying this as well, so that somebody can grab it and get the information and help save somebody's life. And that's what it's all about. And we want to, again, V Church, we want you to put them hands together, put them hand clap emojis and things. And let's thank God for Dr. Calvin Grubbs III.
Yes, excellent job.
Amen.
Excellent job.
Amen. I'm so proud of him and all that he has done and all that he has accomplished. First of all, I also want to thank you for your service to our country.
Yes.
For your service to our country and all that you have done for our country in the military, and then coming out of that and taking care of families with their health. We really appreciate it, and we thank God for you.
Yes.
I appreciate your service. Thank you.
Your parents did well.
Amen. Amen. Again, family, those of y'all that came on a little bit later, we want you to type and let us know where you're watching us from, what city you're watching us from, whether you're on YouTube, on one of our YouTube channels or one of our Facebook channels. Please let us know where you're watching us from. And then we also saw someone wanted to know how they could donate to the ministry. We will put that on the screen. That is our Cash App information, as our PayPal information, or you can just go simply to our website. And if you go to our website, you can click at the bottom of the screen and see any of that information on the bottom of the screen. But as Dr. Calvin is on his way out again, I want to say it for the record for those of y'all that are watching and know that we've done this Cash App thing for the different guests we brought on. He has specifically asked that we do not do that, because he wanted to get this information out to the people. So
Thank you.
We thank him for not saying, "Hey, I'm gonna charge you $500 for my time." Insurance information. We appreciate him. But again, V Church, let's praise God for Dr. Calvin Grubbs III. I can't wait till we get out to Tacoma and go get some. I ain't gonna eat no clam chowder, but I'm gonna get some shrimp and some fish.
Okay.
All right, sir. Thank you. Love you. I'll hit you up in a little bit.
Appreciate you. We really do.
Amen. Amen. Again, V Church, were you all blessed on this evening?
Yes.
Hallelujah. With Dr. Calvin Grubbs III.
Yes.
We
awesome.
hope you were blessed by that. We try to deal again with the taboo topics on Real Talk Tuesdays that the church generally won't deal with. But we also want to get information in your hand.
Yes.
We want to get knowledge and information in your hand, in your mind, and get it before you. Again, go back and watch this in entirety, because some of the questions that came in later were already answered earlier. So I don't want nobody to think that we did not answer your question or ask your question. It was already answered earlier. So go back and watch this in entirety. Again, share this so that someone else can get this information, and or tag someone so they can get on and get this information again. And we want to thank again Sister Zelica, Brother Calvin Grubbs Jr. For raising such a phenomenal young man.
Amen.
And him willing to give his time again to make sure that we get this information out to everyone. And so again, family, we love each and every one of you. We pray God's choice blessings up on you. And as we normally say, live your best life by living a kingdom life.
You don't never give me no words to say at the end. I'm saying.
Sorry. You normally don't want to say anything. What you want to say?
No, I do be trying to say stuff, babe, but you know, you just be going. You be flowing.
Sorry. Go ahead.
You be flowing. It's all right. You done said everything now.
No, go ahead. Tell everybody Calvin's nickname.
I don't think he wants me to tell that. He don't want me to tell that. That's my baby, though. That was my baby. That was my first child that I didn't have biologically, but that's my baby. That's my baby. And to see him all grown up and the things that he has accomplished and that he is accomplishing is just beautiful. Just beautiful. I'm just so proud of him. And I just love his mom and dad. But I am just proud of him, and I know both his parents are just glowing because he's an awesome man of God. But yeah.
Cool.
Love you.
Cool. Thank you again, Dr. Grubbs. V Church, we thank you again. We will see you on tomorrow evening for prayer at 7 p.m.
Yes.
We want to pray with you on tomorrow evening. And again, we want to remind you of this Sunday is our Code Red Sunday. We're wearing red in support of Heart Health Month.
Yes.
And so we want you to do your hashtags, mykingdomlife, take your selfies and ussies and stuff and post it. Let us know that you're wearing red in support of our Code Red Sunday in support of Heart Health Month.
Amen.
So again, we'll see you tomorrow at 7 p.m. But until then, let's say it again, baby.
Okay.
Live your best life by living a kingdom life.
High five.
We love you all. Grace and peace be with you.